Hi everyone. So this is going to be our training on reintegrating into the workplace with our COVID-19 mitigation plan for the offices. So at Hope, there's a lot of conversations that we have ongoing for years about wellness and resiliency. And a lot of what we talk about when it comes to resiliency is trying to find our new normal. So with the current COVID-19 pandemic that we're experiencing, the likelihood is that it's not going to be going away anytime soon. And so instead of focusing on trying to get things back to how they were before, this is where we need to find a way to be able to safely go forward. So in that spirit, with Hope trying to find our new normal, so we're introducing ideas and plans for us to be able to reintegrate into the workplace in stages, to be able to do so according to best practice for mitigating the risks when it comes to communicable disease, and to be able to do whatever possible to be able to keep the people that we care about and support safe. At the end of the day, all of us contribute to the safety of everyone else around us. And so not just for our own comfort and our own safety, but for those of the people that are around us, we need to make sure that we're doing things in a safe way to try to get back to as close to our normal as we can get. And so in that spirit, we're going to be talking now about what we're going to be doing in phasing back in our workforce to the office buildings in a way that is conscientious and safe for everyone involved. Now, with this idea of a new normal, we understand that people are concerned about their own safety as well as safety of their family members. We also want people to know that that we are making sure to go forward in a safe way. And in us going forward in a safe way, this is where we want to be taking people's concerns seriously, and we actually had sent out a survey to office employees to be able to ask about your own feedback and concerns, because we want to make sure that everybody involved feels safe coming back into work, and that we know that we're doing what we can to be able to maintain that safety for everyone at Hope. Now, things that we're going to be doing. Stuff that we notice walking around the office buildings is that our offices were not necessarily designed originally to maintain social distancing. And because of that, we want to be conscientious of the number of people who are in the building, who is coming through, and also how we're moving about that building. And so all of our office buildings will remain locked, and people will only be permitted to be coming in after you have already gone through a screening to be able to come into the building. And this is going to include temperature checks for people entering. Now, because we don't want to create a choke point of a lot of people showing up to work or leaving at the same time, because we have a few entrances and exits to the building, we are also going to be allowing for a staggered start time and end times for people's workdays to be able to work with some of that traffic control. In this vein, we also want to make sure that people are following the posted guidelines for how you want to walk about the building. Our hallways are not 6 feet wide, and so if we end up in a situation where two people are passing each other in a hallway, by definition, they're going to be closer than 6 feet away and therefore not maintaining social distance. And so we want to make sure that we have clear guidelines of where we're entering and where we're going. We also want to make sure that we're limiting people coming in. And in that vein of limiting people coming in, we want to make sure that the people who are coming into the office buildings are only the people that need to be coming into the office buildings. And so we're only going to be having visitors come to the offices for critical business purposes as approved by leadership. And all other meetings with people should occur either telephonically or through Zoom or other video conference methods. So we still want to try to limit the number of people that we're exposed to. And so we want people to be conscientious of this at work, and as we'll see later, to be conscientious of that exposure when you're off work as well. Things that we want to keep in mind. Common areas that are frequently touched surfaces need to be cleaned daily. Those supplies will be made available to people, and we're expected to not only be cleaning our own workspace at the beginning and end of our workday, but we also want to be cleaning it in the middle of the workday or as required. Hand sanitizer will be provided throughout the building. Now, hand washing is still a superior sanitation method to using hand sanitizer, but as that isn't always readily available, hand sanitizer will be available for those times that hand washing may not be practical. We'll have posters displaying reminders of how to prevent the spread of germs and disease, and we're going to be rearranging the cubicle seating as necessary to be able to allow people to maintain that 6 feet of social distance. Meeting rooms, break rooms, and other communal areas are also going to have a reduced seating capacity and how many people can be allowed in them, because in certain situations you just cannot maintain social distance in a space above a certain number of people. And the two stairways that we have leading up to the second floor of the 540 building, as well as stairways that we'll have in some of our other settings, because that face-to-face passing in hallways and on stairwells by definition is going to violate social distancing, we're going to be marking those stairwells as one way, so that way we don't have to run into those situations where people are unable to maintain that social distance. Now, for things that you can do, the health screenings that many of us have been completing to be able to come into the offices already are things that we need to continue to be doing. Now, each day before reporting to the office, you need to go through that screening with your supervisor, fill out the screening forms to submit to them, or to utilize the SurveyMonkey screening form. And if you mark yes to any of the screening questions for any reason, then you need to go ahead and not come into the office. All right, the only exceptions that we'll have for these are people who experience chronic health conditions that are well documented, and HOPE has the documentation of those chronic conditions in your file. And so if you experience things like seasonal allergies, then you need to go ahead and get a doctor's note to be able to let us know that that is why you're experiencing those symptoms. In the absence of having that documentation, any symptoms are going to be considered symptoms of COVID-19. As far as what you can do, stay home or go home if you're sick. Now, again, I know that many people might have been in a position where it's not that bad or I have a whole lot to do, but at the end of the day, one of HOPE's values is safety and security. And keeping our coworkers, keeping our support recipients, and keeping everybody's families safe is going to be more important than that work deadline you have. And so stay home if you're feeling sick, even just a little bit. Use that time, call out. We also want to maintain social distancing practices while we're in the workspace. Something I've noticed over the last few months when it comes to social distancing is many people greatly underestimate how far 6 feet is. So for some general visual references on that, all right, a large dining table or those large folding tables that we end up using in the auditorium, those are 6 feet long. And so you could have one person on either end of the table and still maintain social distance. But if you have people who are if you have 4 people at one of those tables, you can't maintain social distance with that spacing. Another good reference to be able to have for people is that a human arm length on average is going to be about half your height, because your arm span is comparable to your adult height. And so I'm 5'10". If I end up holding out my arm, then I'm going to end up having, if I hold out my arm, that's going to be about 3 feet. And so if I hold out my arm and someone else holds out their arm and we could touch our fingertips, then our bodies are less than 6 feet apart. And so little things like handing somebody some paperwork, if you hand something to someone and they can take it from your hand, then you're closer than 6 feet, and that is not social distancing. And so be cognizant of 6 feet and that it's often a further distance than people normally think about, because normally when we maintain a social space, it's going to be about 4 to 6 feet. We also want to minimize groups and times that we spend in common areas. Even if we are coming into the office, maintaining that distance and avoiding large gatherings is going to be really essential. We also want to make sure that these good sanitation practices that many of us have been hearing for months need to continue to be maintained. So clean your work area upon arrival each morning, at the middle of the day, and when you leave for the day. Cleaning products will be supplied, and we want to follow the instructions when cleaning your work areas. We also want to wash hands thoroughly and frequently throughout the day and use hand sanitizers when unable to wash our hands. And make sure to cover your nose and mouth when you are sneezing or coughing. We want to try to avoid touching our face as much as possible, and there are a lot of things that can make this challenging. If you wear eyeglasses, reaching up and adjusting them is a frequent way that people touch their faces. It also might be things like people who have beards touching their faces for that. And sometimes if you're wearing a mask that doesn't fit correctly or it is uncomfortable for you, then people might be frequently reaching up to try to adjust their mask or make sure that things are, sitting correctly. But that's also going to increase the amount of times that people are going to be touching their faces. And so trying to cut down on some of those habits and just being aware of how frequently many people touch their faces. We also want to avoid touching high touch areas. So using paper towel to touch the doorknob when you're opening it up to leave the bathroom, being able to just keep an eye on things that people might frequently have their hands on because those are going to be high risk areas for the transmission of COVID-19. We also want to make sure to wear a face covering in common areas, as well as if you cannot maintain social distancing or more frequently as desired. So 6 feet of social distancing is the standard. If you're having to get within 6 feet of people or you're in situations where that's unavoidable, then you need to be wearing a mask. The way that COVID-19 spreads is generally going to be through moisture droplets in people's breath. A mask can catch those moisture droplets on their way out. And so even something like a just non-medical face covering, not even like an N95 mask, those can actually stop up to 80% of the moisture droplets that might be coming out of you. And I want people to be aware that wearing masks is not just for your own safety. Wearing a mask helps keep people safe from you. Something that is scary but important to remember during this time is that a lot of the spread of COVID-19 happens from people who are asymptomatic, so they don't have any symptoms, or it happens from people who might have really low symptoms, and so maybe they just chalk up their runny nose and a little bit of a cough to seasonal allergies. And so even if you do not feel sick, you could be a carrier. And wearing a mask helps protect your coworkers and our support recipients from you. We also want to try to replace some common practices like handshakes and utilizing things like head nods, waves. I've done hypothetical hugs with my family where it's a few feet away and it's like, hey, just hold your arms out. All of those can be fine, but we want to maintain that 6 feet of distance. We also, again, want to be cognizant of basic workplace things that are normal habits many of us have had. If you walk up and you put something on your coworker's desk while they're sitting there, you're closer than 6 feet. Again, if you hand something to someone and they take it from your hand, you're closer than 6 feet away from them. And so be cognizant of these things going on. Avoid using other people's phones, desks, offices, and other work tools and equipment whenever possible. So kind of keep your own little bubble to yourself. And if you have any questions or concerns that are specific to your circumstances, where you might be working or the duties that you need to be doing, then please reach out and talk to the Human Resources Department. So by definition, the Human Resources Department is there for the humans at Hope, which is going to be all of us. And so if you need anything, again, please reach out. We also want to be able to follow all company policies and practices. So regularly we have been putting out COVID-19 updates, and these are explicit expectations for our employees at Hope. And so, not a suggestion, we need to follow them. But we also want to be kind to people. This is a time of a lot of uncertainty and insecurity, which is going to cause a lot of stress for people. Right? There can also be things that are just very hard to get used to and adjust to. The reason why you've heard me mention handing stuff to people multiple times in this presentation is that's a big one I've personally been struggling with. When I do test proctoring, it's just a very easy habit for people to walk up and hand their test to me. And if I'm not actively thinking about it, I'm just going to reach out and grab that from them. And then we just violated that social distancing. And so it's easy for people to make mistakes, and it can be easy for people to forget to do something because they may not be in the habit of it. And instead of ridiculing people or trying to talk down to them about it, remember to be kind and patient with one another. All right, if something does happen, please correct it, but do so kindly and gently, because we all do better when we all do better. And particularly in times of stress, we need to be kind and look out for one another. We also want to continue to practice social distancing behaviors, all right, and not just at work, but when you're out of work. So the unfortunate reality is when it comes to communicable disease, our activities can bring that into the office. And so if you're going to large barbecues, there's a lot of people you might be exposed to. For people who are frequently going to the grocery stores, those are going to be points where you might come into contact with somebody else who has been infected. If you're doing things like trying to spend time with family members visiting over the summer, but they've traveled within the last few weeks, that can put people at risk. And so, not just at work, but in our personal life, we need to try to do what we can to limit our exposure to other people, because our exposure to other people comes into the office. And so please, I understand that it can be very frustrating to try to maintain some of these, especially when the rest of the state is opening up and many other people are starting to relax. But when you look at the cases of COVID-19, particularly in things like hospitalization and deaths, disproportionately that has been impacting care settings and assisted living homes. And that means that the people that HOPE supports are the people who are most likely to not only be affected by COVID-19, but most likely to die from it. And so our actions help maintain the safety of the people we support and the people we care for. And so please maintain that diligence and vigilance even when you're off the clock. We acknowledge that Alaskan DSPs are essential, right? We could not do the work that we need to do without you. And so we want to remember that as essential workers, you're coming into close contact with people who are vulnerable and may not be able to recover if they get COVID-19. And for the office staff reintegrating into the buildings, we're coming into contact with those DSPs as well. So even if you don't provide direct supports, they have to come into the building when they're getting their test proctoring. They'll have to be able to come into the building or at least access our Dropbox when they're dropping off their notes and picking up other important documents. And so even as office staff, there's only a couple steps of separation between us and contact with our support recipients. And so maintain these standards even when we're off the clock. Social responsibility compels each of us to act with consideration and integrity by avoiding unnecessary risks in our off time. And remember that open doesn't mean over. Any activity with multiple households in the same space is considered medium or high risk for exposure to COVID-19. And though some of us may be okay with the idea of you getting sick, I don't know if there would be any of us who would feel very good about us getting other people sick and hospitalized. So again, even if it's just because we care about the people that we support, and we want to make sure that the members of our community are safe, these are things that we all need to be aware of. And it becomes harder the more relaxed the rest of the state does. And so we need to keep this in mind, and we need to intentionally make sure we're maintaining it. Now, frequently asked questions that came up when we did our survey of our workforce is the question of, can I continue to work from home? Now, we explicitly expect all employees to report to work at our office unless there's a legitimate reason for continued telework, such as somebody with a compromised immune system, caregiving responsibilities, or things that prevent them from returning to work temporarily. And if you have any of these situations, you should talk about those specific circumstances with someone from Human Resources. We will be bringing employees back to the office in phases, and we want to look for communications from Human Resources on your expected date to return to the office. So we never expected telecommunication to become a long-term solution. And in many ways, we need people to be coming back into the office to make sure that we're able to do the work that needs done. And so though telework might be something that many people find to be a lot safer, we can still make sure that coming into the office is a safe practice. One of the most dangerous things that a person does on a regular basis in the United States is get in their car and drive somewhere. Now, driving is a necessary evil. We need to do it to be able to go about our daily lives. And so we follow speed limits, we keep our vehicle maintained, we wear our seat belts, we look before we go into intersections. And when we do those things, we make something that is an inherently risky activity more safe because of our diligence through our behavior. I'm asking you to apply the same kind of concept to coming into work. There might be some inherent risks, but when we take the proper precautions to be able to mitigate those risks, we can still do something that has some risks in a way that is not more inherently dangerous than necessary. In the question of is it safe to return to work, when we talk about communicable disease, the honest answer is there is no such thing as 100% safe. However, when you take those proper precautions, you make things as safe as possible to the point where those risks can be very manageable. And so at Hope, we plan to follow federal health and safety guidelines as well as guidances from the state and local governments, and implementing these practices such as health screening, social distancing to be able to keep those risks as low as possible for ourselves and the people around us. Hope will also allow for staggered work shifts because we don't want there to be a choke point of everybody showing up to work at 8 a.m. and everybody trying to leave at 5 p.m. So being able to stagger when people are coming in and going to be able to control that flow of traffic is going to be part of what we're going to be doing. Now, with those, talk to your supervisor about some of that flex, but we're still expecting people to maintain as close to regular business hours as we're able to. As far as the question on do you have to answer medical questions when reporting to work, the answer is yes. We need to make sure that people are going through those screening questionnaires every day that they're coming into work. And as we saw previously on the slides, temperature checks to come into the building. And it's something that I understand. I've been having to fill them out every time I go into the office over the last few months. I got a stack of over 30 of these guys that I've had to go through. And it may feel frustrating and it may seem a bit invasive. However, it's something that maintains our safety and the safety of people around us. Because if we make sure that we're not having people come into the offices who are symptomatic, then that greatly increases the safety of everybody involved. And once again, if you feel sick at all, do not report to work. If you're already at work and you begin feeling sick, notify your supervisor immediately and immediately go home. Employees can also utilize their accrued sick and vacation leave that they have available and contact Human Resources for more information on those available leave times. The question on do you have to wear a mask at work? Yes. You're going to have to wear a mask at work, at the very least while you're in common areas and in situations where social distancing cannot be maintained. So they're not necessarily required to be worn at all times. If you are at your own desk more than 6 feet away from people, if you happen to be outside, again, more than 6 feet away from people, then you do not need to be wearing your mask in those situations, although you absolutely can if you would like to. Now, if you have positions with frequent person-to-person contacts, then you may be required to keep it on. Now, if you don't have a face mask, contact your supervisor so we can provide one for you. And if you have a medical condition that restricts you from wearing one, then please speak to Human Resources. I understand masks can be frustrating. Many people feel kind of claustrophobic when they're wearing them, and it can be quite uncomfortable. And that's unfortunate. But with that, making sure that you have a good mask or non-medical face covering that manages to feel comfortable, that you can actually wear for extended periods, and making sure that you plan opportunities to be able to maybe step outside or go somewhere where you have that distance to give yourself a mask break, it can be something that can be perfectly manageable. But when we're in the office and have that risk of not being able to maintain social distancing or being in common areas, then masks will be required. The question of if we will have in-person meetings. So, in order to promote social distancing, some meetings are continuing to be restructured. So, sometimes there might be in-person meetings with limited attendees in a space that is large enough to allow for social distancing between participants, because as many of us have learned over the last couple of months, Zoom, although it's a really amazing platform, is just not the same of in-person communication with people. And so when able, having in-person meetings with a limited number of people in a large enough space to maintain distancing may still be a thing we try to do. But some meetings are going to be including virtual options for people to be able to attend from their personal workspaces. And so maybe we have something like a PMT meeting where different supervisors are going to be attending from their various computers over Zoom, even if people happen to be in the building. The question of how will positive cases of COVID-19 be handled in the workplace? People are going to get sick. And in the absence of having a vaccine, COVID is not going away anytime soon. And so despite all precautionary measures we may take, there is always going to be a risk of exposure to communicable disease, not just while we're in the office, but when people go to the grocery store, when you pass people on the streets. That's kind of the nature of communicable disease. And so we don't just want to have good safety precautions in place to prevent the contraction of it. We want to have good policies in place on the eventuality that someone is going to get it. And so should an employee contract COVID-19 and expose others in the workplace, then we'll immediately inform all employees of the possible exposure. Now, the infected employee's name will not be shared with their coworkers. That is not information that other people are going to be getting. But employees who have been potentially exposed will be sent home and asked to work remotely for 14 days, and then a thorough cleaning of the workspace used by the infected individual will be conducted after the area has been closed off for at least 24 hours.
In conclusion to our COVID-19 mitigation plan for the office, some parting thoughts that I want to be able to leave people with. Now, many of us have gone through the MANT training that we offer here at Hope, and a big thing that they emphasize is to affirm your feelings, but choose your behavior. I understand that there can be a lot of stress associated with some of the precautions we've talked about in this presentation. And I can tell you that there's a lot of the things that I personally don't enjoy having to do. I eat entirely too much garlic to wear a mask all the time. It also makes my beard itch. I don't like having to do it, and with me being hard of hearing, it can be really challenging for me to understand what somebody's saying to me when I can't see their mouth. However, these are small inconveniences. And though I know many people talk about personal freedoms and your ability to choose your own behavior, we need to acknowledge the fact that our behavior affects the people around us. And that if we make decisions not to follow some of the guidances that we've talked about, that makes things less safe for the people around us. And ultimately, that means that for them to be safe, they have to further alter their behavior that limits their freedom. Which means for people who genuinely believe in freedom, independence, and people's ability to access their community, then it's responsible for that community to act responsibly. And so whether you're at work or you're at home, remember that the stuff that we do allows the people who are most vulnerable in our community to be able to live as independently and freely as they can during this stressful time. Another thing that I would like to acknowledge for people is the fact that When it comes to these restrictions, we might run into many people, many of us are friends and family members, who may not be following all of this guidance, not just at work, but in their personal lives. And a mantra that many of you have heard me say during various trainings is other people's bad behavior doesn't justify our own. I realize many people may not be taking COVID as seriously as we are, and that a lot of the state is opened up and does not have to follow the same restrictions we do. But the restrictions that we have in place from Senior and Disability Services and the Department of Health and Human Services are there for a reason. They're there to be able to make sure that the people who are most vulnerable in our community have as much freedom and independence as possible, which is absolutely something that is consistent with every part of Hope's mission and our beliefs. And so as we go forward and start to reintegrate into the workplace, and as we try to establish that new normal in the world we find ourselves in, remember to be intentional and thoughtful in your own behaviors. And make sure to make choices that you feel are justified and you can defend. Because in this time, our actions towards our community and in that community affect everyone around us. And so please be safe. And though things will be different reintegrating into the office, I, for one, am going to say that I look forward to being able to see people again. And so I hope everybody has a great rest of your day. You stay safe. Bye.